So moving to the next syndrome, we'll talk about what is known as a Meconium Aspiration Syndrome. Alright, so for Meconium Aspiration Syndrome, I'll just give you guys an overview, just a short story about it, then we'll proceed. Now, meconium is the name given to the first type of feces that you as a person will pass when they give birth to you. Do you understand? But sometimes, maybe due to like a baby is over mature, that's a baby is in the stomach for more than the 42 weeks that is required, or sometimes due to stress, due to a lot of things, maybe oxygen supply is not optimal, the baby will now pass this first stool right into the amniotic fluid. Now the amniotic fluid is just a contained space. Alright, now this feces can circulate in the amniotic fluid and the baby will inhale it. Of course, it will lead to what? Respiratory complications. Alright, so we said that it occurs when a newborn inhales meconium-stained amniotic fluid. Now meconium is the first poop, that's the first type of feces you pass as a human being, you know. So this is before, during, or immediately after birth. So meconium is the first baby stool. It's thick, it's sticky, alright. It's made up of intestinal cells, mucus, bile, and more. So while meconium passage is common in the late term pregnancies, aspiration can lead to serious respiratory issues. So that's why even trying to like give birth to a baby, they usually rush it. Do you understand? Because they don't want this baby to actually pass this stool within that space. So why it happens sometimes is fetal distress. So the baby is stressed up. Alright. So this can cause meconium-stained fluid to enter the lungs. Right. Most common in full term or post-term babies. Okay. We see it. So symptoms in babies, they have difficulties in breathing, or their breathing is so rapid. Their skin is now bluish. This is because blood supplies and oxygen supply is not optimal. Right. Grunting sounds, lumpness or low muscle tones, then chest retractions. Diagnosis is you might actually want to do imaging to look at the complications in the chest, like x-rays, blood gas tests to check the levels of oxygen and carbon dioxide, physical tests like you're trying to listen to the breath sounds and all. So treatment is this person lacks oxygen, so replace oxygen. Okay, ventilator support, surfactant therapy, antibiotics, if you suspect that infections will come up, and all of that. Right, so that's just it for the concept of Meconium Aspiration Syndrome.